Hi, my name is Danielle Stylen and I'm the PA at Caring Medical, and I just wanted to go over a couple of the most common shoulder problems that we see in the office and ways that you at home might know if you're a good shoulder prolotherapy candidate based on what you see today. So at the office we practice prolotherapy, which is a regenerative injection technique used to stimulate the healing of injured tissue. Now when someone comes in for shoulder pain, most of the time they have pain in the front of the shoulder. Sometimes we do see patients that have pain in the back of their shoulder. Maybe, when they move their arm, their shoulder blade hurts as it slides across their rib cage, or they have pain in the back of the shoulder. Most of the time though, it's usually the front that's the problem. So probably one of the most common things that we see is a rotator cuff tear. Many of you may have heard of it or have one. And someone with a rotator cuff tear, as I try to move her arm, they might start to be wincing right about here. It really hurts. I can get them to get full range of motion, but it's not the most fun thing they've ever done because it really hurts. They might have trouble even reaching for something, in a top cabinet like this. But most of the time the pain is right here. The reason why is the rotator cuff is made of 4 muscles. The supraspinatus is actually the one that gets injured the most. This one comes over top of the shoulder and attaches right here. That's where the tendon attaches. Most of the time this is what gets torn or injured if you fall or have a traumatic injury, or even simply from overuse. If you're a tennis player and you're constantly serving a ball, that might cause some problems in this rotator cuff tendon. Someone that has a problem with their rotator cuff, aside from having trouble lifting their arm up top or out to the side, might also say they have pain that keeps them up at night. If they roll over onto their shoulder, it hurts. If they have an injury and they kind of baby it, if she just kind of kept her arm by her shoulder because her elbow by her side because her shoulder hurts so much, she may even long-term develop a frozen shoulder where I wouldn't even be able to move her shoulder more than this because it's kind of locked in that one spot. That's why if you're a young athlete or even a middle-aged person that likes to stay active and you have shoulder pain or you suspect you have a rotator cuff tear, it's best to get it treated or addressed right away because you don't want to develop a frozen shoulder and cause more problems. At the office, we do prolotherapy to all the rotator cuff tendon attachments as well as all the ligaments that surround the shoulder. The reason why is, let's say, if she's a tennis player and she's constantly doing this all day long, chances are she would injure a tendon but also a ligament. Ligaments are the tissues that surround bone to bone, so you have quite a few that help kind of keep your shoulder together. If you're likely to injure a tendon, you're likely to injure a ligament as well with the same motion. Also, we see a lot of labral tears. So the labrum is actually a thick ring of tissue that helps to deepen the socket of the shoulder joint. So it kind of helps to just hold the ball of the humerus right in that joint. If she, fell onto an outstretched hand, got a direct blow to the shoulder, or even dislocated it, those are the most common ways that your labrum might tear. Now she might say, I feel really weak, I do have full range of motion, but I feel like I can't carry things that are heavy. If I just take her arm like this and I move it back and forth, I might be able to feel or even hear an audible kind of clunk in there. That's pretty, commonly seen with a labral tear as well. If I press on her, she might be tender kind of all along those attachments. Again, let's say she dislocated her shoulder and she fell or got hit with enough force to knock it out of the socket. Chances are she tore the labrum kind of on the way out, and she's probably injured a lot of these other ligaments and tendons as her bone has suddenly shifted. So again, she might be really tender right here all along these tendon and ligament attachments. She might even, if she just holds her arm like this and tries to resist against my arm, she might feel pain and weakness here. The reason why is her biceps tendon, so here's your biceps muscle, and it actually attaches to the labrum. So if you've torn that, you've probably, or I shouldn't say probably, but you've likely injured part of the biceps tendon as well. So you might be weak and it'd be hard to resist. Again, prolotherapy, we treat labral tears all the time. Sometimes if someone doesn't get better quickly, with normal dextrose solution, we might have to actually get cells from their blood. That's called PRP, or platelet-rich plasma, and then we actually inject that back in to help heal the tear, and that does work really well. When I had mentioned, with a labral tear, you might hear some kind of clunking. You actually also might hear a clicking or a popping kind of sound if someone just has general shoulder instability. So I might be, just checking her range of motion like this and hear click, 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 or if I'm even doing this, it might click and pop. She might say, whenever I roll over or reach for something, it makes a sound, and that might just be diagnosis of shoulder instability. Again, ligaments are the tissues that hold bone to bone, so if they're a little bit lax or they get injured, they can't hold those bones together as well as they should, so that shifting can cause some popping, it can cause pain. She's, again, might be tender all along these attachments of the ligaments because they're loose, they're injured, so it's not going to feel very good when I push on them. But prolotherapy right into that tissue will stimulate repair. So, let's say, if she had joint instability and she never got it taken care of and just kind of let it go, maybe took some anti-inflammatory medications to help with the pain, she might actually accelerate the arthritic process, because as those bones shift a little bit more, when those ligaments can't hold them, they're going to wear and tear on cartilage, wear and tear on all the other surrounding structures, and really start, to accelerate arthritis. Long term, she might even start to develop bone spurs as the body tries to come up with a way to compensate for that chronic instability. So that concludes the diagnoses that I wanted to talk about for the shoulder. If you have been given this diagnosis before or are suffering shoulder pain and think that this might sound, like you, we'd love to hear from you. You can email us directly at info@caringmedical.com or visit our website, www.caringmedical.com. Thanks for watching.